I guess we could start on I'm Robert Orthwine. I'm the director for the Office of Behavioral Health at Colorado Department of Human Services. Thanks for having me today. Go to the next slide, please. So why it's important to discuss behavioral health, specifically as we talk about the ARPA funds, Recovery Act. We all know that before going into the pandemic, there has been a great need for reform in the state of Colorado on our behavioral health system. There's been a lot of unmet need in Colorado. 1 million Coloradans have a behavioral health need, and 20% of Coloradans reported their mental health needs not being met. It's really important, and that's all pre-pandemic. And we know the pandemic has just exacerbated behavioral health needs since then. And so we need to address the impact of the pandemic on mental health and substance use. We also need to make sure that our behavioral health needs exceed our existing resource. We make sure that our resources are available, because currently our behavioral health needs exceed our existing resources. And all of the funding for ARPA, as well as the Trump administration stimulus funds, there was behavioral health funding as well in there as well, in what we call our block grant. So we have two block grants. We have the mental health block grant and the substance use block grant. And that's federal money that we receive every year to address community-based services. Now, they're somewhat restricted in what they can be used for. They cannot be used for brick and mortar, and they can't be used for inpatient. They can be used for community outpatient type services and efforts. All these efforts really align with the reform from the Colorado behavioral health system. The governor, almost 2 years now ago, created the Behavioral Health Task Force, and we have since created a report of the blueprint on the reform that we need to take place in the state of Colorado. Next slide, please. So the stimulus funding sources, as I mentioned, the mental health and substance use block grant increases. Now that includes both the Trump administration had given us funds for starting this year and next year for both of these block grants increase. They essentially doubled. And then under ARPA, the block grants is increased again, doubled from their original amount. For a total between the two block grants for both stimulus increases, about $94 million. Now, the ARPA funds can be spent over the next 4 years. So a lot of the focus has been making sure that whatever we do doesn't have a cliff effect in 2 years, and spreading the efforts out over 4 years. And I'll talk a bit more about what those specifics, some of the highlights of those are. The other funding source is Senate Bill 21-137. This is $100 million that was set aside with the ARPA stimulus funds for the General Assembly, and they identified some specific immediate needs that they wanted to start increasing behavioral health efforts on. Then the third is the General Assembly Interim Committee. So there's going to be an interim committee later this summer, and this is sort of led by the General Assembly. And they're going to determine how we spend $450 million of behavioral health funds one time, and really focused on transformational efforts. Next slide, please. So the block grants, there's $94 million across 2 one-time allocations. So to be spent over 4 years. So just divide 94 million by 4, and that's essentially how we're by and large spending the funding over 4 years. Some of the key efforts that we're funding are peer-based recovery support services. So we really want to expand. One way to expand the workforce for mental health and substance use is utilizing peers as a service, and allowing individuals who are licensed to focus on what only they are permitted to do within their license. And all the other work and the other efforts and the other support services and intervention services that you don't require a license, that we have peers being a part of that workforce, and we call that workforce extenders. They're workforce extenders, and that's part of our solution to the issue of workforce when it comes to behavioral health services. Others are more funding for residential substance use treatment, withdrawal management, and voluntary commitment services. Really continue to fund the substance use treatment in Colorado, working along with our partners at Healthcare Policy and Finance, who have now added substance use residential as a reimbursable service under Medicaid. The third is workforce supports. So this is really funding to expand the workforce in Colorado so that we cover the cost of people to get trained and certified to be addiction counselors or peers. We also have intensive community-based treatment for adults. So we're really setting aside funding to make sure, and this is really ties with Senate Bill 19222, which says that the state needs to develop a robust safety net system in the state of Colorado that has the right intensive services. So we need to make sure that we are building up services like assertive community treatment, which is intensive treatment, intensive intervention, wraparound services for adults in the state of Colorado. Helping people with mental health and substance use find and keep jobs. So helping with really helping individuals get jobs and keep those jobs is an important component of stability for these individuals. And it's called individualized placement services. Is the name of the program that we sort of fund and we enhance as we move forward. And then connect pregnant women and parenting people to treatment and recovery. This is typically a population that requires special attention to make services unique and specific to this population so that they're able to get treatment and parent at the same time. Increases to the behavioral health crisis system, including secure transportation and promoting equity and diversity in the workforce and access. So we really need to do a better job of diversifying the workforce, having more bilingual workforce, but also access as well across all different populations in the state of Colorado, and make sure there's equity there and that all people in Colorado have access to behavioral health care. Next slide. Sorry, what is the, I'm looking at the questions here. There's what is the date and time again for the ARP public meeting? Don't think that question was for me, but, or is that the General Assembly meeting? It's later this summer. I don't know, but I think that's what we're referencing. It's still unknown at this point. So the next one is 137. This is a bill that was passed last session for $100 million. Some of the key components: statewide care coordination infrastructure. So this is information sharing, and this is taking the different systems. It's not replacing care coordination where it exists. It's about making it more efficient and effective, and creating an infrastructure, and most importantly, a gateway for the public to know where to go, where to start, where to find information about services in their community. We really want to use technology to make it easier to access information about care and where to meet for the care. So workforce development is the other. There are several areas. One, incentivizing people who are in school to go into behavioral health, so looking at fiscal incentives there. The other is some funding to retrain the child welfare workforce. So 4E is a funding source in child welfare. They sort of remodeled their system to say that they're really only going to pay for treatment-related care in residential settings. That's not family settings. That has to be treatment-oriented, and they're going to pay for certain prevention services. Well, this funding really is going to retrain the existing residential workforce to be certified in those programs that 4E will reimburse, so we can draw down as much federal funding as possible. And then there's some money to train up the other existing workforce on doing intensive community treatment services so that we can expand our workforce through Senate Bill 19222 as well. Next is increasing access to substance use treatment. So that was a big component. There was lots of funding, both to the county and to the managed service organization. To do both, to put more money into substance use treatment. So there's money going to counties, and OBH is going to be distributing those funds. We're working on an application process, and there's also money going through the managed service organizations directly to increase funding through 202 services. So those are two areas where counties can have a lot of influence and say and sort of what services are going to look like in their community. The crisis system, including children and youth, so some funding there. There's two groups for children and youth. There's $5 million for enhancing crisis services that's specific to the needs of children and youth, and making sure that we have services available that can stabilize youth in their residential or home settings, I should say, family-based settings, so that they're successful. Jail-based behavioral health services, there is money that's going to jails throughout the state for their behavioral health services. And then there's a child welfare pilot program for residential placement of children and youth with high acuity physical, mental health, and behavioral health needs. This is $5 million that's going to the Office of Children, Youth, and Families to work with counties and providers to develop a program by which we have more settings that can serve kids with complex needs. And then the last is some money for housing assistance program. This really is support services, mental health support services or substitute support services that go along with housing needs and housing funding. So the money for the jail-based behavioral health services being automatic, or do we need to apply? I believe it's actually, so there is an application process where jails do apply to that. Now, this is a funding source that already exists. So this would be additional money to what jails are already receiving. Jails do submit an application now in which we provide funding, but it's more of a, the process is more, here's your allocation. What do you plan to spend this money on? Sort of approach than you may or may not get money. Most counties do get money. Next slide. And then the interim committee, like I said, will meet later this summer. It's led by the General Assembly. It does has county reps on the subcommittees when I saw from the bill. It's a one-time investment that will be transformative, and it will require legislation in 2022 session to spend. So it's not going to be available immediately. And next slide. The key takeaways for local government is how do we invest in a shared vision for behavioral health in Colorado? How can we work together with you all in regards to the intersective funds such as opioid settlements? So we want to make sure that we are working together, and I know I'm big on this, that we're trying to figure out. I'm big on the local solutions and how the state and local efforts can align so that we're not competing, bifurcating our efforts. So when we talk about the opioid settlements that are supposed to come into place, how can we work together to have funding those efforts and identifying the needs through data as well. As we fill out the continuum services, information feedback will be critical from you all to us about what's working, what's not working. And that is what I have.
Thank you, Robert. Sarah.
Great, thanks, Chantel. Thanks, Robert. I'm Sarah Lipscomb, and I'm our Director of Operations for Community Partnerships. And I'll go ahead and talk about all of the other human services programs besides behavioral health. And I'll keep it really high level as we have a lot that's going on in human services. And most of the funding automatically went to counties or to our individuals and families. But I will touch on a few grant opportunities that would be of interest to you all. So first of all, why is this really important? Human services really targets low-income Coloradans with a lot of our economic security programming. And we know that the pandemic was really pushing a lot of our families and individuals further into poverty. So a lot of our strategies were targeting those families and individuals, making sure that they did not fall farther into poverty. We also are responsible, and our county partners are responsible for child welfare and adult protective services. So we know that a lot of issues came up with the pandemic, families being quarantined together and lots of alone time, adults having a lot of isolation, just lots of things that folks hadn't experienced until the pandemic that we really had to keep an eye on to make sure that all Coloradans were safe and we were really helping them with their well-being. So we've got some funding to talk about there too. And then lastly, our early childhood sector, really, really important to help keep those doors open for our child care centers, even when folks were staying at home. So we've got lots of funding, lots of strategies to help keep those doors open, make sure that kids are in quality child care and really help with that continuity of care, and then help parents get back to work as the economy rebuilds. So going to the next slide. So as I was saying, our funding is dispersed in a few different ways. A lot of it goes directly into the pockets of low-income Coloradans. And I know we've talked about it some on these calls before, but lots of food security funding. So what's called our SNAP max allotment. So that goes directly into individuals' pockets and allows them to get a higher SNAP amount each month in order to meet their food bills. We also were able to receive federal funding through the stimuluses to help with our LEAP program. So that's folks' utility bills, really making sure that they were able to make ends meet there. And that funding goes directly to the utility providers. We were really excited. I know we've talked about it on this call as well. We inherited a brand new program. We've never been able to provide water assistance before for low-income Coloradans. And that came out from the Trump stimulus bill in December. So we are still getting that program up and running, and it should be happening in the next few months. And again, we'll align with our already existing LEAP program or energy bills, and that will help pay arrearages and help folks meet their water utility needs moving forward. We also increased our child care assistance, so that subsidy that goes to low-income families in order to receive child care, which also really helped keep those doors open for our child care providers. And then lastly, just our basic cash assistance that goes to our TANF families. We were able to increase a few one-time payments for them to help make ends meet through some of the federal funding. Then we also have funding dispersed directly to our county. So the vast majority of the human services work is administered by you all and the county partners. And so our child welfare, our adult protective services, and all of our economic assistance programs did receive increases in funding due to the stimulus straight pass through in those allocations. And then lastly, I want to touch on some of the grant programs because that's really where that flexibility is for you all to potentially get more funding in your community. And on the next slide, the grant funding is really based on early childhood. We have so far received 3 times the normal budget that we do for early childhood in the state of Colorado through all of the stimulus efforts. So you'll see here, we've got several different strategies that each of the stimulus efforts just keeps building on. So a lot of it is around those workforce supports, access to high quality care, really ensuring that we have enough staff for early childhood mental health, and then a few other really innovative approaches and funds for really helping move the needle on meeting our early childhood needs across the state. But what I wanted to focus on for you all are these sustainability grants. And this 35 million was the last round of grants. And we also had state funding from the state stimulus that helped with these sustainability grants as well. And our ARPA funding grants will start to become available this coming August. We're still working with the federal partners on ensuring that we are meeting all of the compliance requirements for those before we send out the grant application. So we'll make sure that folks here know when those applications are available, but that's really the one I wanted to call you all's attention to, that you should be partnering with your early childhood councils and your child care providers to get ready in August to apply for more funding. And next slide, please. So lastly, the really big takeaways are the vast majority of the human services funding went straight to county human services through our allocation. So really make sure that you're working with your county human service director. They're going to know what your unique community needs are and where any flexible funding could be helpful to meet those needs where the allocation funding isn't. Second, really work with your child care providers. We're going to continue to have, like I said, those grants open in August and lots of other funding coming through the pipeline for early childhood. And we want to make sure that all communities have access to that. And then lastly, I wanted to touch on in the human services world, We've seen a lot of great benefits, as I was saying, go straight into the pockets of low-income Coloradans, that it really helps them stay in the black and meet their basic needs each month. We are trying to get prepared for towards the end of the year when unemployment benefits are no longer the same. As I was speaking before, that max allotment for SNAP will potentially go away. And we're really worried about the cliff that we're going to see for some individuals and families that are going to have a really steep loss of funds that they had been receiving this last year. So I would highly encourage you all to work with your human service directors on that. Like I said, that will probably start happening at the end of this calendar year. And how can we make sure folks know what they are eligible for and what other community resources like food pantries and other things are available to folks to help make ends meet as some of these extra benefits will be going away. So I know we only have 2 minutes left, so I'll wrap up there and happy to answer any questions.